Yesterday, I posted a video about the recommendations made in 2009 by ACOG and then subsequently supported by the USPSTF to delay pap smears until age 21, even in those individuals who are sexually active. And I want to talk about it some more because there were some people who are still talking about getting pap smears and having procedures done on their cervix, and then other people who say, I had precancerous cells and I wouldn't have known about that if I didn't have this pap smear as a teen. So let's break it down. Human papillomavirus infection, or HPV, is the most common sexually transmitted infection, and it's the main cause of cervical cancer. There are over 100 subtypes of HPV, with them being classified as either being low risk or high risk. Low risk types are associated with warts or genital warts and low-grade cervical intraepithelial lesions seen on pap smear or on colposcopy, otherwise known as precancerous lesions, and high-risk types are associated with the development of cervical cancer. In the United States, 8 out of 10 individuals will have an infection with one of the subtypes or even more of the subtypes of HPV at some point in their lives. So if all of this is true, why are we not recommending that teenagers get pap smears to assess for abnormal cells on the cervix and HPV infection? Abnormal pap smears in teenagers are very, very common, but up to 90% of those lesions or infections will be cleared by the immune system of that teenager within 2 years. Number 2, over-screening teenagers with all these pap smears can be very detrimental because, number 1, they're getting the stigma of having abnormal pap smears. They're having to undergo these procedures and pap smears multiple times during the course of their teenage years, especially for something that's likely to be cleared by their body on its own. And there's also more likely to do more harm than good, because if they have abnormal pap smears, they're more likely to get colposcopy biopsies, LEEP procedures, or even cold knife cones, again, for something that's more than likely to be cleared on its own. And that could potentially cause problems in pregnancy when they do become pregnant in the future. Finally, let's talk about HPV vaccination. The rates of cervical cancer have drastically dropped since the introduction of the HPV vaccine in 2014. The ideal age to start the HPV vaccine series is age 11 or 12. But it can be given as early as 9 years old or even as late as 26 years old. The HPV vaccine can reduce the risk of HPV-related warts and cervical cancer by up to 99% when the individual receives all the recommended HPV vaccines. It is one of the most effective vaccines that you can get. There are some teens who should not wait until age 21 to get a pap smear, and those teenagers include those who have HIV infection, organ transplants, or long-term steroid use. If you have questions about when to start getting pap smears for your child, or if and when to get the HPV vaccine, talk to your pediatrician.